Good evening, good afternoon, and good morning. This is the 1678th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Prakash Rao. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to, and from 8:30 to 9:30, we have the international session in English from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that Mr. Session can watch it again and you can share it with your friends, so that the purpose of the forum is to take homeopathy to every home around the world. And today we have a guest from a research field, that is Dr. Prakash Rao. Just now, another session in Hindi that was also on research subject. And today, Prakash Rao sir has already presented a session last time about the research paper, but this time sir is saying the second part of the same. Let me introduce sir. Sir has completed BA and then PG in rehabilitation, MD in homeopathy, PhD in homeopathy, and is a retired research officer, CCRS Government of India, has more than 30 years of experience at CCRS and undertook various projects with the UNICEF and AIDS Control Society, as well as a lot of research work has been presented in this forum, as well as a one of the most wanted faculty for international presentation about research work. And sir, last time presented a paper on homeopathic aggravation and genus epidemics. Today, sir, we'll be talking about the second part of the same. So we proudly welcome you to the session, sir.
Sir, can you hear me, sir?
Yes, yes. Now everything fine, sir.
Can you see my slides, sir?
Yes, yes, we can see you, slides and everything.
Okay, sir. Now, sir, Dr. Dhanus, sir, I am very much thankful to you. I know names of 2 persons, Dhanush, Manoj, and Dr. Kuru. Why I am telling that I am very much thankful, which I have to tell at the last, I am telling to you for the first time is, sir, now basing upon my research, this is my individual research. I worked in CCRH, everything. I carried out my biodata is very good. I worked in JIPMER, everything is good. But this expenditure on homeopathy, what I spent on homeopathic aggravation, has now, Dhanesh sir, you can tell from this, I want to finish this chapter in 2 topics, but I want another topic next week or after some time. Today I will complete half of the topic. Now you can proudly tell, Dhanesh sir, that homeopathy is not unscientific and homeopathy is scientific.
Yes, sir.
This is not a concept or anything. This is totally immunomodulation experimentation of homeopathic aggravation. And we have seen the biostatistics, we have seen the cases, we have taken the blood samples, what is the homeopathic aggravation and what is the immunomodulation. Everything has been compared. Now, if your support is there, Dhanush sir, definitely there will be, see, we can fight with the WHO, we can fight with all allopathic doctors who are criticizing, and we can fight. And this is the basic where the homeopathic aggravation has made homeopathy to tell that homeopathy is not unscientific, and homeopathy will be totally scientific. And this is the fundamental research. Had we carried out the fundamental research, if the government organizations or whatever it may be, except physicians, and particularly physicians like you, devoted physicians, who stick it to homeopathy despite of all the problems from last 200 years in India, including the quacks RMP doctors, I bow my head. It is because of their sticking to the fundamental system of medicine, which made me to carry out the research even at this age and spend money. And that is going to this homeopathic aggravation is going to make to tell you all the homeopaths in the world that homeopathy is not an unscientific system of medicine. But unfortunately, such research will not be funded or will not be given guidelines or appreciation or anything. But a researcher or a scientist, whoever works, they never work for anybody's appreciations or citations or awards. They work for their satisfaction. So that is the part and parcel of the research work I am carrying out, and it has clicked out. I will show you the authentication proof, everything in my next this one. Let me tell, because I am over enthusiastic today, Ganesh sir. So how the homeopathy has working, what is the immunomodulations? Now let me show you in these 20 slides. Right now, what is homeopathic aggravation? Last time I told the total literary review of homeopathic aggravation. You all physicians know about homeopathic aggravation. Now in this chapter, we will analyze, we will study. I will finish by 9:15. I will give for discussion. We have to discuss. I never say questioning or answers. You have to discuss. Today, Dhanush sir, Manoj sir, or somebody be ready and guide me, because the next week we are going to reveal the statistics. So, homeopathic aggravation. Last time I told the literary research, the concept of Kent, concept of Robert, concept of Herring's carbon, concept of Herring's law of cure, what Hahnemann told about the concept of boric. Somebody believed, somebody criticized Hahnemann, Boninga, everybody, whatever they added something to concept of Hahnemann. But the concept of Hahnemann is right, sir. And the concept of Hahnemann will be always right. We never worked on fundamental research in the basis of organon of medicine. So some of them we missed. You will understand through my slides today. So homeopathic aggravation, I am telling these small things. Literary research is over, and who has forgotten, they have to go and see my previous slides. I don't want to share this time because of this new invention of scientific theories. So aggravation, temporary increase in the symptoms after administration of correct remedy. So here this sentence is very small. After administration of correct remedy and homeopathic aggravation comes. But if homeopathic aggravation does not come, it doesn't mean the prescription of a homeopathic physician is wrong. Homeopathic aggravation never comes in every patient. What are the statistics? I will tell you in next slides. So this is considered as a positive sign. What is the speciality of homeopathic aggravation? It is a positive sign that body is responding to the vital force, is being stimulated. What is this vital force is stimulating? I am an immunomodulator. I am a scientist in homeopathy. I am carrying out the latest research work. But I came back to the vital force stimulation. This also you will see what is vital force. Any well-indicated medicine potentially causes homeopathic aggravation if given in appropriate potency. If you bring a patient, if you want to see the homeopathic aggravation in him, if we 2-3 people work together and select a similar remedy, and if we give in higher potencies, definitely we can produce. Every patient is a homeopathic, suitable for homeopathic aggravation. It is only the physician's quality, the guidance and efficiency of the physician making him not to get homeopathic aggravation. See, if homeopathic aggravation comes, usually in concept of Hahnemann up to 5th edition. I am not talking about 6th edition. This difference also 6th edition, 5th edition will come in my later few slides. So the concept of homeopathic aggravation we can bring with my new scientific study. What has been proved is we can bring homeopathic aggravation if you want to make the patient as a guinea pig and want to see. Otherwise, usually homeopathic aggravation never comes. It comes one patient out of 1,000 patients, because that occurs, that happens. In which cases it will come, I will tell you. So instead of telling the immunomodulation, I again came to the concept of Hahnemann. Vital force is being stimulated. Any well-indicated medicine, see, these all are small things for everybody. But as a researcher, particularly in immunomodulation and immunology, these all words are great words for me. And this is showing the modern contemporary immunological outcomes of the homeopathic aggravation in a scientific way. Then we will go for our second slide. Homeopathic aggravation, again, temporarily worsening, intensification of the symptoms. What is the quality of homeopathic aggravation? The symptoms will be intensified after taking homeopathic remedy. The phenomena is reported by patient after medication. See, if I tell scientifically on a dais or a platform, so as a researcher, somebody may accept, somebody may not accept. But in your clinical practice, you have seen various cases suffering from homeopathy, which produce homeopathic aggravation, and where the normal physician confused it between homeopathic aggravation and disease aggravation, and they stressed their strain while treating the patient. As a clinician, as a physician, what they faced, you might have understood in your day-to-day clinical experiences. But you do not know that this is homeopathic aggravation, or people may not know, or even after knowing what are the tools, they will confuse, because the patient will be often coming to the clinic and disturbing the doctor, and that will create the burden of the patient. In the sense, socially you will be the responsible person, so you will develop stress. But here I will prove it scientifically. And the patient experience an increase of existing symptoms. What happens in homeopathic aggravation? The existing symptom will increase. And symptoms that were not present before case taking may also come, the new symptom. This never happens in every patient of homeopathic aggravation. Again, one patient. Again, if you take 100 patients like one patient, in the sense, out of 10,000, if you go to 1 lakh patients, we may get around 100 patients. If we get 100 patients, 10,000, see, out of that 100 patients, again 10% of the patients will go for new case, new symptoms, and which were not present when we have taken the case record. Then homeopathic aggravation is scientific. Some remedies are more commonly associated with noticeable aggravation. Every homeopathic remedies, and if you select on similia similibus principle, every drug never produces homeopathic aggravation. Some of the drugs, they are highly sensitive and they work on each part of the body. They are well proved, so they have a quality of producing homeopathic aggravation. And homeopathic aggravation will be confused with adverse reactions. See, every modern technologies in medicine will criticize homeopathy for its toxicity. Now recently from Kerala, which you have condemned, that liver toxicity, alcoholic toxicity. When he found out toxicity, the toxicity comes in 2% of the patients. Then what happened to other 98% of the patients? So when the adverse reaction came from the homeopathic drugs, then where is the positive reaction? Why he hasn't told him the positiveness of the drug? So he himself is not sure. His studies are not up to the mark. He is not from a research institute. He is a practicing doctor. Out of his cases, because of influence, he uttered some words. So when there is adverse reaction, the adverse reaction comes for 2 persons out of 100. Homeopathic aggravation, 1 person out of 1,000. The adverse reaction is 2% out of 100 persons. The adverse reaction, anaphylactic action. Side effects, bad effects, contraindications, and drug effects. So if you take a vaccine, suppose in medical science, modern medical technology, as far as today is concerned, the paracetamol is the highest, having highest efficacy rate. That is around 82% of the cases. It brings down the pain and pyrexia at the temperature, and the rest of all 28% of the patients will fail with paracetamol. The temperature never comes down and the bodily pains never heals. They have to go from non-steroid painkiller to steroid painkillers. Because the 22%, 28% never works. It also produces long-term complications, contraindication, side effects, toxicity, bad effects, and at the same time adverse reactions. So these all have been studied in paracetamol. Why I am telling paracetamol here is, to the doctor who has told that adverse reaction, dying with the liver cirrhosis because of homeopathy, he has to understand The adverse biostatistics says that adverse reaction is a well-proved drug of drug discovery world. This is a modern word, drug discovery. The pathways of the drugs have come. So there the 2% he found out, he has to tell us the positive result, rest of 98% of homeopathic drugs. There he failed. There is nobody to catch. When we were doing this experimentation, we found out that how ignorant he is with his own experiments and with his patients. Then come to our topic. Why I am telling is now today onwards you can confirmly tell that homeopathy is, you cannot criticize homeopathy because there is proof with us. So homeopathic aggravation, an indicator of good prognosis. See, Hahnemann up to 5th edition, he has written good prognosis. Why? A patient experience sense of well-being mentally. Physically, his symptoms may aggravate. So this type of typical immunomodulatory effects are the vital force which is reacting or responding to the treatment will produce such symptoms. So such symptoms will come when the similia sidinibus is correctly followed, that is accurate. Usually what happens when we treat the patient, we approximately treat. Approximation is something different from accuracy. So if we treat any accurately, the treatment will continue, but the homeopathic aggravation will be produced by the first dose itself. Suppose a chronic case came, an acute case came. The acute disease may come down with the 1 dose of homeopathic medicine in 2 days. The chronic case, the 1 dose will not be sufficient to make the warts to fall down. So one medicine also won't be possible for any clinical practice. You are practicing your clinical studies. So homeopathic aggravation will be always a good prognosis as said by the concept of Hahnemann. You kindly forget every other stalwarts who added some concept to Hahnemann concept. We will work out only on fundamental organon of medicine written by Hahnemann. All others are general physicians like you. They know the English language used to be their mother tongue, so they have written the books. The patients in India, homeopathic doctors will see more than Kent, or more than Robert, or more than, I am not praising you or I am not criticizing them, but I am creating an awareness among you. So you people will get more cases in our India, in your clinical practice by paying money. And our government OPDs are highly challenging, where the doctor is very good. It depends upon the individual homeopathic physician. And they are very busy and busy practitioners. This concept is not applied in foreign countries because there the disease conditions were at that time also less, today also less. And so they added some concept to Hahnemann concept. Hahnemann is an experimenter in those times. Nowadays, he will be known as a scientist. So these are the things, these 3 fundamentals, these made us to carry out the research further. These sentences look very simple. What is this? The first year, second year philosophy is talking about this, but this fundamental philosophy is homeopathic science. And what is adverse? Now, last time someone has asked distinguished delegates, what is the adverse reaction? See, homeopathic aggravation, mentally fine. It is a biological, a parameter for improvement of the case, and or it will form the pathway for improvement in chronic diseases. So we need not worry. An assurance because the prognosis is going to come. So we have to find out the difference between in our clinical practice, drug side effects or the adverse events of the drug and homeopathic aggravation. According to homeopathic, why adverse effects? Hahnemann also discussed about the adverse effects because he was so cautious and he was so scientific. He was such an immunologist of those days where the word immunology is not present. He has taken the vital force, vital energy, and his concept is so scientific in this aspect because whenever the experiment we did, when we found out everything, tears were rolling from my eyes because the Hahnemann who made homeopathy scientific, we people, we are incapable of carrying Hahnemann concept and we not trusted Hahnemann. We started developing our own, doubting our own intellectuality. At the same time, we started being influenced by allopathic medical practitioners. The allopathic science is very good. but allopathic medical doctor's psychology is not up to the mark. So that made homeopathy to be criticized, and I faced enough is enough. I think that yesterday when I have worked for this last time, the statistics, now I am very happy that I am the best homeopathic researcher and I am the best homeopathic doctor along with you. So, Edwards drug reaction. What is the medicinal aggravation or the disease aggravation? What the medicinal aggravation? The toxicological symptoms of the medicine will come. The side effect of the drug will come. The physiological effect of the drug will come. Suppose Ipecac you prescribed for cough, and after giving Ipecac, patient may pass loose motions. Because the physiology of the Ipecac is Ipecac in mother tincture form as a bark, as a tincture, used to be prescribed but by epileptic medicines, that is elective medicine. In those days before 1942, by Kent and everybody, in allopathy, in the herbal medicine, to make a patient to vomit the poison. In those days, poisoning was very, very common. One used to poison others. So make the poison to come out. Ipecac in food form, if given, the vomiting will come. So the vomiting will produce chronic bronchitis or the bronchopneumonia in children, and that bronchopneumonia will bring down to the lungs alveoli to constrict. That's why the Ipecac will produce the cough in homeopathy. And as a mother tincture, it is a best medicine for vomiting. As a mother tincture, it is a best medicine to produce loose motions. So the physiological of homeopathic drug Ipecac action, when you give, when it produces, the new symptoms may come, and that medicinal symptoms will appear, and the disease will aggravate. Already child is suffering from asthma or something, childhood asthma or allergic bronchitis. Ipecac is given, he also passes loose motions, and that too dysentery type. So this is the toxic effect of the Ipecac that we have to understand. Usually homeopathic physician will be too intelligent and they know how to prescribe and how to manage. They do lot of hard work. The syllabus, the curriculum, the subjects, the case recording is almost everything. I told around 3 years back that the normal contemporary terminology of homeopathy has been made technically highly scientific, and they have been misused by changing our organon words, and they are known as precision medicine, individualized medicine, genetic medicine, epigenetic medicine. These all are the homeopathic words and homeopathic organon. So in adverse drug event, one is the medicinal drug proving will come, and not medicinal drug proving, the toxicity, side effects, contraindication, bad effects. So what are the contra? During the pregnancy, if coffee is more, there is a chance of getting abortion because Ipecac will produce toxicity. So that is known as drug event. Or the disease itself, or cough will turn into bronchopneumonia, where patient temperature never comes down and patient will fall more sick, and we will be forced to admit patient as an inpatient hospital. The sense of well-being will not be present. And in adverse drug reaction, this one must always follow, and one all must remember this one. Then the homeopathic drug, how to differentiate between homeopathic drug? No reactions, no sense of well-being, again no improvement of the symptom and worsening of the symptoms. This is known as adverse side effects of the drug. Then the types of adverse drug reaction can be understood in two main headings. See, the adverse side effects also we have taken up for study. When adverse drug effect, how it comes? 6 potency, 3x potency, mother tincture, 30 potency, daily 5 doses, 2-3 drugs within 2-3 days without any necessary. So there will be a specific of drug adverse reactions will come. Why the drug adverse reaction has to be studied? Because the organon has given a chapter on drug adverse events. Hahnemann cautioned every physician, whoever follows homeopathy, to be careful from drug adverse reactions as well as homeopathic aggravation. So homeopathic aggravation and drug adverse reaction must be understood concept-wise as well as science-wise. So in science-wise, when we came, more common adverse drug reactions are divided into type A and type B. The less common adverse drug reactions, in the sense, cough, sputum will be going on exceeding. Cough will be less. But whenever he coughs, he will excrete more sputum or burning sensation. The burning sensation will be more, mentally he will be happy. So such things will come. These are divided into two groups, A and B. More common adverse drug reaction, less common adverse drug reactions. If I talk about drug reaction, then only I can go for homeopathic aggravation. So what is A? Dose related. If we give doses in lower potencies related to pharmacological action of the drug, if the physiologically the pharmacological action of drug, suppose if we take Drosera, or if we take cockroach, or Beriberius vulgaris, or Spidospermia, which will be usually prescribed in bronchial asthma, when it is being given in a mother tincture form, it also goes and produces adverse drug reaction, toxicity, and periplaneta. And these all the things, even in materia medica, you will find in Blata orientalis, that if you give Blata orientalis mother tincture more, you kindly open the Blata orientalis in Boric materia medica and see, he will give half paragraph, and lastly he will give caution to the patient, to the physician, that if you repeat the Blata orientalis continuously, the drug reaction may come. Boric do not know, he never did any experiment. He has written a concept, but that concept is right, and that drug reaction is known as the Blata orientalis. If it is too much given, it also produces mucus in the alveoli, and a patient of bronchitis will go into bronchopneumonia. And this is A type of. Then B type, not dose related, uncommon, no relation to pharmacological action of the drug. It is only the drug is not adverse reactions it produces, it keeps quiet, the patient disease will aggravate. So these two you will see. The uncommon is C type, long-term exposure to drug. If we continuously use arsenic more than 2 months, 3 months, 60 days, 40 days, there is one book in homeopathy, how to kill a patient by giving arsenic 6x. In Bengal, I told that those days killing by poisoning was very common. This is an old book. It is not reproducible. Nowadays, we can't also print that book. The ethical committee will catch us. How to kill a patient. The title is How to Kill a Patient with Arsenic 6x. If we give arsenic 6x daily one dose for 40 days, the toxicity, the bone marrow will become malignant, and the patient will die gradually. He will live his life. This is the long-term, uncommon long-term exposure to the drug. Now the toxicity of arsenic, wherever the arsenic water is there, it is also coming. It will be almost like that. Prolonged exposure to the drug. The same drug, if we expose always externally or internally, Blata orientalis, Spidosperma, Grindalia, they all will have a specific smell. That smell itself will bring the symptoms. Prolonged exposure to the drug internally also, and termination of the treatment. So when the such symptoms when comes, usually physicians will confuse in between homeopathic aggravation and adverse reactions of the drug, and they will terminate the treatment. Ultimately, patient disease will become more serious. He will end up in complications. This all needs for a physician, their BHMS curriculum, their daily activity, daily referring the books, daily hard working. Nothing will be gained without any hard work. You, the experienced physician, you know how to come up in the life being a homeopathic physician. So that I need not talk about this. So there will be always confusion in between adverse drug events and homeopathic practice. This we commonly see. See what happened. We have taken cases we have taken around 58 physicians. So when the case comes, usually they will tell it is very tough to understand the difference between adverse drug reaction and homeopathic aggravation, because they will be busy with their practice. Number two, there will be burden, social burden of the patient. A patient will be influential. He won't tolerate for the symptoms, so he will give up. So there will be a lot of confusion, pressure over the doctors, particularly private practitioners. This that they always tell. For a researcher, it is not like that. We will convince, or we will send him to allopathy. Then again, I will bring him to homeopathy. It will be like that. But this never happens with every physician. This is important for physicians, clinicians. The understand concept of Edwards drug events and their theory. The sense of well-being must be present. That is homeopathic aggravation. If the sense of well-being is not present, that is Edwards drug reaction. You kindly take it as granted, because the next slides will prove that. Adopting safety precautions. If you start treatment without any casual prescription, if you start the patient seriously, if you are serious in the private practice, you definitely, people will not do mistakes. No physician in homeopathy will do such mistakes who wants to come up in life. Then the homeopathic aggravation follows the law of cure. Herring's law of cure. Why I kept this here? The Herring's law, Herring added law to the homeopathy. Hahnemann never added Herring's law to homeopathy. So Herring's without any experimentation. Hahnemann was a experimenter. Herring's was a commentator on Hahnemann's experiments. So he, for that also being introduced in homeopathic textbooks. And there is no interrogation of Herring's law. If such type of things are present, so everybody in modern technology will criticize homeopathy if they understand this. Because this is a fundamental Herring's law of cure. See, most of the physicians, where we have taken many physicians, we will take up a survey. Have you seen Herring's law in your private practice or in any case? They will tell in one case 20 years back. Because the Herring's law will not be implemented, will not be seen. At least homeopathic aggravation can be seen. The adverse effects will be daily seen. But the implementation, application and seeing Herring's law will be very less. But that concept is added without any scientific evaluation, like our rubrics. So this type of fundamental research is not being carried out. They want to test the medicines over the cancer. For curing the cancer, you physicians are present. You are trusting, and previously the RMT doctors used to run, they used to do the common door deliveries with homeopathic medicine, calophyllum. They used to keep palestilla, some medicines like that, and they used to carry out normal deliveries. So what is the difference between a qualified researcher and in those RMT doctors who contributed more to the society, and here researchers who never contributed anything for research? So these all are paining points. They are all always make me to think before I carry out. So Herring's law of cure followed in improvement, because the concept, it is added by Robert, the Herring's law of cure, where it comes in homeopathic aggravation. So these all are contradictory topics. Adverse reaction occurs from wrong remedy. This is true, wrong remedy never works. Naturally, the nature disease will increase. Too frequent repetition of the potencies, this already I told. On a sensitive patient, what is the sensitivity of the patient? We don't have any thermometer or any ultrasound or any X-ray to find out the sensitivity of the patient. The sensitivity in homeopathic doctor's mind is the stability of the patient, the normal strength, the normal healthier accept. What is the patient general debility? That will be known as sensitivity, the outside world. But the sensitivity as a immunomodulator is researcher, it will be entirely different. So here the sensitivity means the sensitivity of the immunomodulation of the patient, whether his immunomodulations are right or wrong. See, if somebody takes groundnut, he will develop rashes over the body. But somebody take groundnuts, he will enjoy the groundnuts. So that is the difference. That is the sensitivity of the patient. So it is being used in homeopathy as a small, simple, common word. But as a scientist, it is an important word for me. Factor influencing the, now come to adverse reactions, you understood. Now come to the factors influencing aggravation. Potency chosen, patient sensitivity, depth of pathology. What is the disease? Children or elderly or hypersensitive constitutions? In potency choosing, whether higher potency, more likely to cause more aggravation, whether matched or well. Depth of pathology, how the disease is entered into the pathology. Is the carcinoma of the stomach producing pain abdomen? Is the renal calculi producing pain abdomen? Or is that the cervical spine, some tumor is producing pain abdomen? Or anything that tumor or neurofibroma entering, or it is because of hernia? The clinical diagnosis must be most important. And frequent repetition and miasmatic background. Because in those days, The miasmatic background used to be the diagnostic criteria of the patients. Even in allopathy today, the patients will be diagnosed malignant, tubercular, sensitivity, immunological, endocrinological, pathological, orthopedic, see, dental, dental specialist, and cancer specialist, oncologist, neurologist, immunology, in the same fashion to identify the disease, the Sora syphilis psychosis was added by Hahnemann. For that, again, new concept came for from other persons who never did any experiment. Hahnemann did experiments, he changed organon 6 times. The other persons never did any experiments, not seen Hahnemann, but added to his theory that is being included into the curriculum. The later doctors started, because in our homeopathy, from that day onwards, this practice is going on, where they never accept the old doctor. The Hahnemann was brushed out. They want to come out of Hahnemann's theories, but Hahnemann was experimenter. He knows what is what. He became successful. Because of his influence, the homeopathic colleges came up to America. Because of American doctors, Hahnemann never came. In India, because of Hahnemann, one French doctor came and treated. How it was started, the history of homeopathy, you know very well. But Hahnemann never came to India and started homeopathy colleges. So this is the where the unscientific people have entered into the scientific era of homeopathy at Hahnemann time. So again, here comes now the 10 slides I talked about adverse drug reactions, homeopathic aggravation. Now these 10 slides are most important for me. I will take it now. It is 9:10 according to me. 9:20 I will finish. See the homeopathic aggravation, scientific explanation, immunology and homeopathic aggravation, a contemporary interpretation. See, I have to take protocols, how I will do my research. So I have to make a concept like Hahnemann. See what is the homeopathic drug reaction. And if I want to carry out on the basis, if the homeopathic drug aggravation comes, the aggravation that homeopathy means that is sensitivity connected with immunology. I am an immunologist, a homeopathy specialized in immunology, where the cases are responding to autoimmunological disorders as well as bleeding disorders, which are connected with immunological treatment. So when we give homeopathy as immunological medicines, the percept it is only on constitutional basis. It is only on the symptomatic basis. But I will call them as homeopathic immunomodulatory drugs, and that are I am getting very fantastic results. So when we have to frame a protocol in a scientific manner means without expecting the positiveness of the outcome of the results or negative outcome of the results, we have to carry out the research. So that research will yield the fruits. So we should not be biased. We should have around us all allopathic and homeopathic doctors and the patients who will give consent, who want to undergo, where the homeopathic aggravation patient, to catch a homeopathic aggravation patient, it is very tough. It is very, very rare case. So we have to get a drug induced. Then see artificial homeopathic drug aggravation on healthy human being. Then patient diseased homeopathic drug aggravation on diseased human being. At the same time, the normal healthy human being on placebo. These three have been compared. Now we will come how this a contemporary interpretation of immunology came. Temporary intensification of existing symptoms follows a well-matched remedy, seen as a sign of healing and vital force stimulation. Vital force, I am an immunomodulator. I am an immunologist. Now I am coming to the vital force stimulation. See, that is the correct word. What is immunology says? See, homeopathy says, follows a well-matched remedy, temporary intensification of existing symptom, seen in signs of healing of vital force stimulation. The immunology says, immune system, body's defense with regulation, homeopathic aggravation, possible immune activation event. This is the immunological word. Aggravation with side effects or aggravation, physiological healing and response. See, this is what the immunomodulatory words for homeopathic aggravation. Then the homeopathy, see again here, homeopathy and immunology. You kindly see this table, whoever is interested. the 24 participant highly distinguished delegates, kindly go through this table. The vital force, innate and adaptive. There are two types of adaptive immunity and acquired immunity. So vital force response is adaptive immunity to homeopathic drugs. Miasmatic imbalance is immune dysregulation. When you psora, syphilis, psychosis, so the stage has increased means the immune dysregulation comes. The vital force will react. If you choose on miasmatic basis, then you will see that vital force will react. This is the vital force. See, miasmatic vital force, not vital force to miasmatic. Remedy action. See, you will take the case, you will repertorize. Repertory is Hahnemann knows Boning Hassan. Boning, he was very happy with his work because lot of work he has done. So it was formed in a table form. But the other repertories, they are all table written repertories, not each symptom has been evaluated. Even in Kent repertory, the demand of his clinical experiences were added. Most of them, even the latest repertories, see, falling, I have shown last time also from great repertories, but we will purchase and no, they are totally unscientific. No, the Hahnemann repertory. See, remedy action, miasmatic imbalance, vital force reaction, immune modulation, immune dysregulation, and immune of bringing adaptive immunity. These all were the concepts of Hahnemann. When I took them to modern technology, they have given these answers. So, basing upon this modern technology, the drug adverse reaction as well as homeopathic aggravation has been proved. So, what is immune response and homeopathic aggravation? Immune response says fever, rash, fatigue, weakness, rash, fever, mild temperature. What homeopathic aggravation? Signs of immune activity. If a vaccination, I will tell you, instead of comparing homeopathic drug, a vaccination, a polio vaccination or DPT vaccination has been given to child. Child will have mild temperature. There will be rash around and there will be fatigue, 2-3 days weakness. Then child will become all right. That is isopathic system of function. The signs of immune activity, that is in homeopathy, they know as, in homeopathic drug also, patient, what happens, if he is a fever patient, if he is not a fever patient, he is having joint pains. The joint pains will be relieved, he will develop fever. The fever will come down, he will develop rash. The rash will develop, he will develop weakness. This is immune response. Yes, sir, I will give time. Yeah, another 5 minutes. So, signs, similarly to cytokine release, what happens? It will immediately produces antibodies into action. So, cytokines will be released and may reflect into immune recall, detox, deployment, redeployment. In the sense, antibodies will go to kill the antigen, that is antigen will, antibiotics will be developed. The antigen is a foreign particle drug. It want to kill the drug, but it will go and it will take the help of the drug. It will deploy the antigen antibody symptoms. When the antibodies will increase, they will make friendship. So that antibodies will recall and detox. In the sense, they will make friendship. That's why patient feels mentally all right, physically suffers. See, this is the pathology, immunopathology of the homeopathic drug action. And this is not a concept, sir. This is the where we have taken blood samples and proved. Similarly to cytokine release. What happens when cytokine is released in the body? Cytokines are part and parcel of our body. There are two types of cytokines. One is anti-inflammatory, pro-inflammatory. The anti-inflammatory cytokine, suppose today we have taken food. The food is, say that that will cause or some kira or something like that, or proteins, or anything that is sweet, or too much of chicken, mutton. So where immunomodulation comes, when what happens, they will produce pro-inflammatory cytokines. Immediately the body will tell that pro-inflammatory cytokines in my owner have increased. So you kindly secrete anti-inflammatory cytokines. This is known as deployment and redeployment. The forces will increase. So after 24 hours, the food that has been digested will be passed away. The pro-inflammatory cytokines will die and they will go in the urine and they will go in the fecal matter and sweat. The anti-inflammatory cytokines will win, and patient from food things. Suppose he takes without his knowledge, see sometimes nighttime ice creams, early morning the immunomodulation will come. So pro-inflammatory cytokines will increase in a healthy human being. This is known as cytokine release, fever, fatigue, inflammation. Reflex of immune detox, the toxic effect of the drug, recall or rebalancing. They recall the antibodies and they rebalance the comparable to healing cries in functional medicine. This is known as homeopathic aggravation and immune response. These were seen with our eyes. I will show the slides. So what is the minimum dose? Immune threshold. The immunity of a human being will have a threshold. Suppose if you poke 2 doses of the vaccine for a person, just because you are accustomed, exposed to the vaccination, I am giving the example of the vaccination. Suppose you have taken vaccination, people were given vaccination, 2 doses, the second dose never works. The first dose is sufficient. If the third dose is given, it will produce side effects. If you give paracetamol 500 milligrams, it's okay. But if you give 1500 milligrams or 2000 milligrams for a patient with mild fever, he will develop severe weakness. This is known as minimum dose. Whatever the dose that is being fixed, that must be given in allopathy. In homeopathy also, whatever the dose that you fix to the patient, you must be have enough knowledge of homeopathic materia medica. You have to build up your own. See, a homeopathic physician is always a researcher like me. Don't think that homeopathy, it is only your experience that will make to develop art of homeopathy. But the science of homeopathy is your knowledge. So the immune threshold you will see, but you do not know that that is immune threshold. You will prescribe 30, you will prescribe 1M, you will prescribe 0 by C potency, 0 by 1, 0 by 2. That depends upon you. That is known as immune threshold. This immune threshold will be decided by the patient, by the physician, without knowing that he is following the immunology. And the low potencies, gentle immune nudge, 6x potency you are giving, lycopodium. Then whatever the 6x potency, whatever the proving symptoms are present in 6x, they will come. So you must be thorough with prover pharmacology. You must be thorough with your physiological symptom lycopodium. You must be thorough with your materia medica. You must be thorough with the disease that you are curing with lycopodium. So how laborious hard work. And aggravation may reflect a potency overshoot. Sometimes you may prescribe higher potency. Aggravation comes. Aggravation may occur if potency exceeds threshold. See, 10M medicine was given for a small child to bring down the watt. So the watt may inflame, that inflammation will enter into the body and he will develop bronchopneumonia. So mirror hypersensitivity, reaction in immuno. This is known as mirrors. What is mirrors hypersensitivity? Your own figure will be displayed in mirror. So if our face is ugly, we cannot break down the mirror. In the same fashion, if the homeopathic aggravation is there, it is directly responding our own body to our mirror. This is known as mirror hypersensitivity reaction in immunology. So this action was also seen in homeopathic aggravation. Then what I got out of this, I got clinical perils, jumps. I was proud to be a homeopathic researcher, and I am today proud that I am doctoring with IFPH, Dr. Dhanush, Manoj, Purup, everybody, whoever is present, the 25 people, that you people have to keeping your strong support and your confidence that homeopathy is totally scientific if it is scientifically practiced. This is the theory. Aggravation is not dangerous if well managed. Support with hydration, rest, drainage. This is told in homeopathy organon of medicine. Whenever this type of allergies comes, we will do same thing in our immunology department. Monitor hypersensitivity or immune compromised patients. When there is rash, there is fever, we will ask the patient to stay for a day. Antidote only if aggravation is prolonged or distressing. See, distressing means physical symptoms are coming. That means the drug reaction is over. It caused homeopathic aggravation. Its action is over. It disappeared from body. Now the new symptom is choices were given by Hanuman with his concepts. But the person died when I am alive. If I could have been with him, I could have saluted him. Oh, my dear master, your concepts are today the scientific. And see, enjoy. Wherever he is, if he sees on his birthday this month, he will be the very happy with my work. So, the drug proving versus when I have seen, then I started going to drug proving. The drug proving versus immune challenges. Homeopathic provings. Remedy exposure to healthy individuals. This is immunomodulatory word. When we exposed an healthy individual to a remedy, there is pharmacist, allopathic pharmacist, who is being exposed, giving pharmaceutical medicines in the pharmacy department through a narrow window, and around him all the antibiotics are present. He is developed because of smelling of antibiotics, smell for more than 3 years. He developed irritable bowel, IBS. So this is homeopathic proving. Remedy exposure in healthy individuals, or he has taken remedy. So immune challenges test, this also present in homeopathy occupational disorders. So immune challenges test, observing immune behavior under exposure. What immune challenges test? What are the symptoms he is going to develop? This is known as observing immune behavior under exposure. He is under my control. I have given him drug. I have proved the drug. What are the drug proving symptoms will come under my exposure, under my supervision? He has been exposed to the drug, and this is immunomodulatory word. Both reveal system vulnerabilities and reaction patterns. Homeopathic drug proving also reveals the system vulnerability. It produces the symptom and reaction patterns. Reactions. Herrings has died with surkuku snake poison because of the drug provings and toxicity of the drug provings. Because he do not know what is the duration of the drug he has taken last time. So he has taken another drug. Like that he was going on taking. He proved various medicines. Ultimately his body became toxic and he died, collapsed. His liver failed. He developed cirrhosis of liver. When the autopsy was done, he was found arsenic because he was proving arsenic. So this is known as system vulnerability and reaction patterns. Recently what happened in London and America, patients have gone, the who are against homeopathy, the all allopathic doctors have taken the pills of 10M, 1M potencies, they swallowed, they showed that they don't have any side effects. Homeopathy is a placebo effect. Had they have been given either Blata orientalis or Spidosperma in 6x or 3x, they could have seen the symptoms. That's why these allopathic doctors are habituated to write the drug reactions of the homeopathy, adverse drug reactions. When the fools should have a knowledge, when they have produced a drug adverse reaction, means what are the reactions of the drug? They studied, but when the drug reactions are more positive, more than p value, so they keep quiet, they started criticizing. When a fellow found some reaction, when what is the other anti-action? So these are allopathic doctors, they senselessly argue. Then homeopathic aggravation reflects dynamic immune adjustment. Immune and homeopathic models both recognize self-regulation. See the immunology and integration can improve understanding the patient communication. When we integrated with protocols, we have taken how many patients? We have taken 9 patients. To get 9 homeopathic aggravation patients, what I have to do, sir? When I gone to every doctor, pillar and post, when I am telling that out of 10,000 patients, 1 patient will come, every doctor I will go, they will tell that, sir, homeopathic aggravation. Why this homeopathic aggravation word is used? He don't want to tell that he has not given the correct prescription. When the disease is producing, when adverse effects are coming, he don't want to accept. So he will tell that, sir, homeopathic aggravation came, sir, nothing happens, he will be cured. Because they want to sustain, they want to support their own theory. They are private practitioners. So whoever gives any type of the case under the banner of homeopathic aggravation, and from my OPD, from my research cases, I collected around 100 cases means, sir, how much long time toil? That means around 1 lakh patients, 1 lakh individuals given just like that homeopathic medicine. And when they produced sensitivity and they were brought out of that, we could study 9 patients. Rest of all became once we brought them to hospital. All right. So their blood samples were compared with healthy human beings. So this is the homeopathic aggravation reflects dynamic immune adjustment in homeopathy. Immune and homeopathic models both recognize self-regulation. Integration can improve understanding the patient communication. When Hahnemann has proved homeopathy, he don't know what is immunology. Right. This is this one. Now, the cases which we have studied, when we have taken their blood samples, which drugs will produce homeopathic drug reaction, which drugs never produces, what are the acute diseases where the homeopathic aggravation will come, what are the chronic diseases the homeopathic aggravation comes, and what are the no source, different types of the 6 types of the medicines from vegetable kingdom, from plant kingdom, for animal kingdom, no source sarcos, which drugs are having capacity to produce homeopathic medicine, and these all homeopathic drugs, adverse reaction, homeopathic aggravation studied in fifth organon. Hahnemann directly got angry. He has gone to LM potency. When
Okay.
LM potency has been given,
Okay,
so
sir.
why we have to study? So this is the again point of argument. I have to get convinced. You have to give me chance for my third part to show my
Yes, sir.
scientific
Yes, sir.
experiment.
Yes, sir.
And today we will end. And you kindly you can ask if
Yes, sir.
in 4 minutes are left.
Yes,
Thank
sir.
you.
Only few minutes remaining. Anyway, sir, it's a great tribute. You have just given a great tribute.
Sir, now it is your responsibility to look after that this study will go among homeopaths and you have to look after, sir. I am giving this to Manoj,
Definitely, sir.
everybody, whoever
Definitely.
is listening, all 31 persons,
Yes,
certainly.
yes, sir. This is a great presentation and great tribute to Dr. Samuel Hahnemann
Yes, sir.
because we all know that the birthday is coming up just within some 4 days from now. It will be on April 10th. We are celebrating the day, but it is a great tribute as far
Yes,
as.
sir. Yes, sir. I became, after a long time, I became emotional after seeing the double blind study in this
Yes,
also. When the
yes,
immunologist, who is the director of JIPMER, after giving authorization letter, these all I will show in my next
you are,
slide, see how we have carried out the research
you are trying
and
to
how genuinely, and I spent around 70,000 on this research.
you are you
See,
are taking yes, sir. You are taking great effort to
so,
uh,
sir,
look.
kindly believe, I request everybody, if anybody says homeopathy is placebo effect, say no. Placebo is also scientific. That
Yes,
topic also I will speak, sir, next time. Now
yes,
you
sir.
have to give me third part of homeopathic aggravation. I,
Definitely, sir.
I
Def-
thought that it will be very easy, but at least out of these 32 persons, if one or two, 3 persons
I mean,
understand my
yes, yes, no,
agony
sir. No, sir.
and think that is
Everybody,
sufficient for me.
everybody was listening. I am inviting Dr. Marian Salcerda from Bolivia to say a few words to this presentation. Marian?
Manoj sir, good evening.
Yes, sir. Yes, my Dr. Marian.
Thanks, Dr. Ganesh and thanks, Dr.
Thank you.
Prakash. It was
Thank
an
you.
amazing session. All the daily we are getting deep in the knowledge. And the way that you approach how the immune system is modulating by homeopathic remedies and how aggravation or homeopathic aggravation happens is just amazing. So I enjoy a lot. I learned a lot. And there are a few things that I will be just thinking, and then maybe I will contact you just if I have some questions about. But it was an amazing session. So thanks to all. I
You
feel
kindly ask the question so that I can address in my next speech.
okay. Okay. One of my questions was about the aggravation. You say that maybe you can think if you have an aggravation, an homeopathic aggravation, you have to think about the potency, right? The potency is higher than the vital force
Yes.
of the patient's needs.
Yeah.
But what about in L impotencies? Because in L impotencies, you will wait and final aggravation in the
Right.
treatment.
Then what is other question, madam?
Yeah. So the question is, what happened? Is the same process in the immunity system in the first
Then
aggravation
next
or
question.
final aggravation?
Next question.
The next one is what about a complement system? Do you know about something?
Yeah.
What is happening about all the complements in the immunity system? How they are working, not just like a big immune system, right? Just like a C4, C3. What about cytokines? What is happening with that
Yeah.
molecular area in an homeopathic
Yeah. Now I
regulation?
understood your
Okay,
concern.
sir.
So,
Okay, sir.
sir,
Since the time is over, we can give
sir,
answers in
you
our time.
kindly, Marian, I am assuring you that you will find in my, next time I am preparing only 15 slides so that I can cover the total one. That's why Hahnemann also fed up like these questions. So he changed his fifth organon to sixth organon. He produced LM potencies. In LM potencies book, he never talked high about, except drug adverse reactions, he never talked about homeopathic aggravation because it
Oh,
never produces any aggravation. Whether it is true or not, I will show you with followed by immunological experiments in my third part of homeopathic aggravation.
yes, sir.
Because I will prescribe at that time only 10 slides
Okay,
so
sir.
that
Okay.
I can cover the time.
Now, Dr. Marian, you can say what are thanks to the session also.
So thanks to all IFPH team that we are working so hard to bring us the best conferences in homeopathy world, in all the homeopathic world that we have. So thank you very much and join all our activities, join our YouTube channel, please like it and share it. So see you soon. Thanks, Dr. Ganeshi, and thanks, Dr.
Madam ji, I
Prakash.
am working on your questions. My research is only on your questions.
Oh,
Next third seminar, third part of this homeopathic aggravation, you will get the answers. We don't have time, paucity of times.
okay,
So
sir. Thank you, Dr. Maria Salcedo. Thank you, Dr. Prakash Rao, and those who attended the session in this evening. A great evening it was, really. And now, tomorrow, we will have a session from Dr. Sheetal Bidri, and she will be talking about a new research on breastfeeding in children. And that's a subject for tomorrow.
one thing, sir, sir, Danish sir, previous speaker, I listened. See, they are all young generation people. They will talk how to take a case record, how to present case record. You have to follow pro forma. The case record presentation in evidence-based medicine is sixth type of presentation. That is lowest cadre of showing the evidence.
Yes, sir. Yes, sir.
Clinical studies are randomized studies are number one studies. Number two,
Yes,
these
sir.
the CCRH people are having one mentality that physicians outside do not know anything.
No, sir.
So,
We all the.
so you physicians saved homeopathy. I am carrying out research.
Yes, sir. We can do, sir. We can.
Understand? You are facing the toil and trouble of the patients. They will beat you, they will ask you, they will question you, and it is because of you people. Now you are qualified doctors. 100 years back, no qualification. Nursing homes were present in homeopathy.
Okay, sir. Thank you very much.
So, sir, that's why don't be carried away with CCRH also.
Okay, sir. Okay, sir. Thank
I
you
am
very
worked under them. Not
much.
talking again is them.
Okay, sir.
Their
Now,
work is not sufficient for homeopathy.
with that, we come to the end of the day, 1679. It's up
Thank
to.
you, madam. Next time you are working on your questions only.
Okay, thank you, sir.
Your
Thank you.
questions, my questions are same for research.
Mariamma
Thank
John,
you.
moderate the Malayalam session.